Hello, my name is Jennifer Otto. I will be discussing improving interprofessional practice to increase ecoliteracy amongst healthcare providers. I'm excited to be a part of those individuals chosen to present at the special session today. It gives me great pleasure to know that health professionals, including nurses, are collaborating with professionals outside of our typical routine. So before I begin, I need to thank those of you at the Canadian Water Resources Association and the Canadian Nurses for Health and the Environment who spent much time making this special session a reality. In recent months, the community that I've lived in has been without water on a few occasions, running water that is. Now, we still had access to a potable water source just a short drive away, but nonetheless, to not have running water is truly an eye-opening experience. For me, this experience made me realize how one can truly take for granted some of the most precious resources we as a species are reliant on. It is ironic that during this time I began to prepare for the conference today. I've included my conference abstract for those of you who may be interested. So many of you might ask, what is ecoliteracy? Well, ecoliteracy is a way of thinking about the world in terms of its interdependent natural and human systems, including a consideration of the consequences of human actions and interactions within those natural contexts. For those of you who are attending from the CWRA, the water system where I live uses something called the Orsono water treatment technology. Those of you who are familiar with the technology will then understand that as a community, we need to be aware of what it is that we put down our drains, as it can greatly impact our access to water. For me, this truly objectifies what is meant by interdependent, and conversely, individuals in more developed areas would not see the impact of their actions on the quality of water they access. The Canadian Nurses Association in 2006 found that more literate nurses are capable of assessing and judging environmental controversies, which helps them to make informed choices and provide appropriate advice to their patients. The water scarcity example I provided in the previous slide was a tangible learning opportunity, one that could assist a nurse in developing a higher level of ecoliteracy and, as a result, better able to provide more appropriate advice to their patients. And when I say patient, this could actually refer to an individual, a community, or a population. A review of the literature suggests that nurses' lack of environmental health training is a barrier to incorporating environmental health principles into practice, inhibiting their ability to address the ecological determinants of health. Nursing education and practice needs to evolve in order to address the increase in environmental health issues, to better prepare nurses to provide them with the scientific information required to participate in decision-making. Nurses are a trusted source of information and are often used to translate information from other professions, such as epidemiology and toxicology. Nurses require further skill development in order to address patterns of symptoms in those they provide care to. The role of the nurse might include adaptation or mitigation activities. Adaptation strategies could include health monitoring, disaster preparedness, and improved water and pollution control, whereas mitigation activities might include lifestyle changes such as replacing passive transportation, such as a vehicle, with more active forms of transportation, including cycling and/or walking. So you ask now, what is interprofessional practice? Well, for those of you who aren't sure, it is known as the process of developing and maintaining effective interprofessional working relationships with learners, practitioners, patients, clients, families, and communities to enable optimal health outcomes. The International Interprofessional Competency Framework, developed by the Canadian Interprofessional Health Collaborative, identifies 6 competencies. Included are interprofessional communication, patient-client, family, community-centered care, team functioning, role clarification, collaborative leadership, and interprofessional conflict resolution. I believe that emotional intelligence is an underlying foundation for each of these 6 competencies in the framework here. So I will take you through a very brief introduction of each of the competencies outlined here. The competency statement for interprofessional communication states that practitioners from different professions communicate with each other in a collaborative, responsive, and responsible manner. When I get into talking about emotional intelligence and the importance of relationship building, it is to assist with communication and some of the variations that exist within professions. Some of you may already know that professions communicate differently than your own. There are different terms, abbreviations, or some words might even have a slightly different meaning. Practitioners need to engage those they serve, value their input, and again, this requires relationship building. The competency states that practitioners understand the principles of teamwork dynamics and group team processes to enable effective interprofessional collaboration. Role clarification, similar to communication, believes that the roles of various professions might vary from what you believe or from what you have experienced in the past. Relationship building and getting to know your group can assist with understanding the roles of other professions. Collaborative leadership requires that practitioners understand and can apply leadership principles that support a collaborative practice model. And conflict resolution views practitioners actively engaged in dealing effectively with conflict. As we talk more about emotional intelligence, it might be clearer what is meant by dealing effectively with conflict. So what does that mean? How does it look? About 2 years ago, I was in an administrative position at one of the Manitoba's small community hospitals. At that time, I was attending a professional development seminar related to interprofessional practice, and the individual who put on the seminar, I believe his name was Lee Quenzel, and he is a psychologist by profession. He, rather than focusing on various aspects known as being a part of collaborative practice, such as those I just mentioned, he focused on the individual and the need for emotional intelligence. So for me, after teaching a course on interprofessional practice and getting into the literature, it became apparent to me that before teaching our students about how to collaborate, we need to first teach them how to be emotionally intelligent. So here is a quick activity for you to think about. Presumably, there are social and healthcare professionals you would trust and those you would not. Make a list of those you trust and those you distrust in your related fields, and try to write something about what it is that makes a professional trustworthy or untrustworthy. Reflect on the basis for your opinion of the relative trustworthiness. In the interest of time, I'm going to move on, but please come back to this slide at some point throughout the conference and reflect on your practice. Think, is your opinion based on personal experience, media portrayal, defense of your own profession, which is also known as turf wars and is often cited as a barrier to collaborative practice, or something else entirely? So when I start to talk about reflection, I think people often worry about the idea of self-talk, but reflection is key to emotional intelligence. The information that follows here is based on Goleman's theory and is specific to work performance and how individual performance in each of the domains relates to success within an organization. Self-awareness provides the underlying basis for self-assessment, and social awareness provides the underlying competency for empathy, leading to relationship management. Emotional intelligence is thought of as a hierarchical process, with the most basic processes being the ability to perceive and express emotions, and the most complex ability is the management and regulation of one's emotions. Some suggest certain emotional competencies differentiate great leaders from average leaders. These skills combined are known as emotional intelligence and is key to relationship building. So using one word, summarize the meaning of emotional intelligence. Tell the person sitting next to you, should you feel comfortable, and perhaps later in the session you would explain why you chose the word you did. Team members who are emotionally intelligent have the ability to create a collaborative atmosphere, an atmosphere that utilizes the inherent skills and power of all group members. It truly is a powerful statement. Self-awareness includes emotional self-awareness. One is able to read their emotions and to recognize their impact using gut feelings to guide decisions. Emotional self-awareness requires we recognize how our emotions affect our performance. For example, a person is often absent from all morning meetings, and sometimes that person will attend but is often late. Does this make you angry? Do you identify the person's behavior as the source of that anger? Perhaps you have lost respect for them as a result. Do you recognize how this situation influences your interactions with the individual and/or others? Accurate self-assessment is knowing one's strengths and one's limitations. And self-confidence is having a sound sense of one's self-worth and capabilities. Self-management includes emotional self-control. This means keeping disruptive emotions and impulses under control. An individual who has emotional self-control does not act impulsively. They do not get impatient or show frustration. They behave calmly in stressful situations, staying composed and positive even during trying moments. Transparency is displaying honesty, integrity, and trustworthiness. Those who are transparent keep promises. They do what they say and they say what they do. They openly and honestly admit to mistakes. Adaptability is demonstrating flexibility in adapting to changing situations or in overcoming obstacles. So you have a person who was supposed to lead a project who is now telling you they are no longer able to do so. You are flexible, perhaps with their level of responsibility. Perhaps this means finding a new lead, something of this nature, or assisting that individual with another work responsibility to allow for more focus on this primary project. Achievement is having the drive to improve performance and is done by setting measurable and challenging goals. Initiative is being ready to act and to seize opportunities, while optimism is seeing the upside of events. Social awareness includes empathy, organization, and service orientation. Empathy is being aware of others' emotions, understanding their perspectives, and taking active interest in their concerns. An individual who has empathy will listen attentively. They pay attention to people's moods or nonverbal cues, relate well to people of diverse backgrounds, and can see things from someone else's perspective. They understand that the people we are working with are all human beings. They have a family, and we take into consideration some of these issues that that individual might be experiencing at home. For instance, a sick child or a sick parent, they might be experiencing financial strain, marital problems, etc. Any one of these issues, for instance, could be the reason for always missing that early morning meeting or for their tardiness. Organizational awareness in terms of a person, it means that they are able to detect social networks and those key power relationships amongst group members. So are there two individuals that really focus on the goal and work together to achieve that goal, or are there a few members of the group that maybe disrupt goal achievement? Service orientation is recognizing and meeting the follower, the client, or the customer's needs. Relationship management includes developing others, inspirational leadership, being a change catalyst. It includes influence, conflict management, and teamwork and collaboration. Inspirational leadership is guiding and motivating others with a compelling vision, and an inspirational leader, they will lead by example and they make work exciting and inspire others. They often inspire others with influence, using a range of tactics for persuasion. Sounds funny, but they have the ability to engage an audience when presenting. They persuade by appealing to people's self-interest, and as a result, they gather support from these individuals. They also are very good at developing others. They can really improve one's abilities, and they do this through feedback and guidance, and they're able to recognize the strengths of others and they give direction, and they might demonstrate in order to help develop somebody, and this can be done in the form of coaching, mentoring, or providing constructive feedback. A change catalyst, they initiate change. They might manage and lead a new project. They might state the need for change, and perhaps even one of the toughest actions would be advocating for change despite the opposition. So you know that this change initiative wouldn't be something that the majority is keen on experiencing, but you still, in the face of that opposition, take on the role of advocating for the need of change. Conflict management refers to the importance of recognizing that conflict exists and be involved in that conflict. You find the position of all of those involved, and one that is supportive of all of those that involved, and this is known as the style of collaborative conflict resolution, which is key to conflict resolution itself, but it is a topic in itself as well. Teamwork and collaboration includes fostering cooperation and team building, which is also known as playing nice in the sandbox. And not only does this mean cooperating with others, but also soliciting the input of others by encouraging the participation of those team members and building close relationships at work. This is where building in time for personal connection is very important. Consider the personal relationship as foundational to the building blocks of a project. Without it, the project will not have a solid foundation to be built upon and might perhaps fall apart. In this section here, you see 3 of the collaborative care competencies highlighted: collaborative leadership, conflict resolution, and team functioning. The role of emotional intelligence within interprofessional practice is multifaceted. Emotional intelligence is connected to interprofessional communication, and it is required when interacting with individuals, communities, and populations you are providing a service for. It is key to team functioning, necessary when you are seeking role clarification or providing solid leadership within a team, and especially during conflict resolution. An individual with a high level of emotional intelligence will be better prepared to function in the work environment that requires strong collaboration skills. One key step is building connection. Those involved in a collaborative effort need to feel that they have a shared purpose, that they're on the same team. Easier said than done, right? Well, I understand it's difficult to achieve, but here are 3 tips that you can use when working to shift towards the new frontier of collaboration. Build in time for personal connection. When we meet across the table wearing our roles, we carry our history, and thus may automatically scan for threats. Think back to that first activity that I asked you to do about trustworthiness, and when you reflect on your vision of trustworthiness amongst those professions, what is it that made you list those key points about trustworthiness? Was it your previous conception of those professions? So think about that. When we first create connection through getting to know the person, we find that all these people are actually human beings, that the person you are interacting with are human beings too. They might have a family at home, perhaps a sick child or a sick grandparent. They could be experiencing financial strain or marital problems. And through building a personal relationship, a new door opens. And this time is not just nice to have, nor is it wasting time before we get the real work done. It is essentially groundbreaking. And without it, that foundation of collaborative practice won't necessarily be there. It'll be unstable. Choose your emotions. Consider how you want to feel and how you want others to feel at the end of each meeting. Pay attention to your emotions and the emotions of others. Noticing and silently naming your emotions can be a powerful way to stay present and move from defensiveness to openness. Engage optimism. An optimistic perspective increases hope, broadens possibilities, and supports innovative thinking. Focusing on solutions and desired outcomes, even in the face of significant challenges, helps you see beyond the present to shape the future. Consider interprofessional collaboration in relationship to your work setting and relationships. Do you work within an organizational unit or across organizations? Do you work differently with other professionals in different organizational settings? It may help if you keep a diary of your collaborative work over the course of a week and reflect on your approaches to collaboration in those different settings. Here are some references used to develop the seminar today. I will now open the floor to comments and/or questions about the presentation itself. Thank you.